credentialed therapists, they've passed the exam. Now this exam is designed to tell us who has a basic level of competence. It's mainly a written exam with a bit of testing of some hands-on techniques.
Passing the credentialing exam means that the candidate understands the concepts and the principles of MDT, and passing the diploma ensures that the candidate can apply these principles to treating real patients.
There's quite a large skill difference between a credentialed therapist and a diplomaed therapist, but we do need to recognize that credentialed therapists do hold a significant skill level over clinicians who, say, maybe have attended one course or received some background on McKenzie in their university training.
The diplomaed clinician is better prepared to help the more difficult case presentation, one not responding to standard MDT care, or the one requiring a higher level of clinician-applied forces for resolution of symptoms. A fair analogy might be that the CERT MDT clinician is akin to the general practice doctor, and the diplomaed therapist is akin to the medical specialist.
Now the diplomaed therapist has 3 great advantages over this credentialed therapist. First of all, they have 9 weeks of training with a tutor in a clinic with real patients. The refinement that took place for me at this level was phenomenal, and I would do it again. Second, the extra online course that's completed gives you time to delve into the literature and understand the method in a deeper level. After the diploma program, I could finally defend myself in discussions with people who just don't get MDT, or they have some uninformed bias against it. I knew the literature and I could speak at their level. I could also spot when people were making claims about what they do that was not supported in the literature. My confidence soared after the diploma program.
Over 600 hours of university-based distance learning gives the candidate a sound knowledge of all the relevant peer review literature, plus the ability to critically, and the importance is critically, evaluate research articles. 600 closely supervised clinical hours in a specialized McKenzie facility will really hone the assessment and treatment skills of the candidates.
Having the opportunity to follow patients with supervision for this entire period gives the therapist insight as to how MDT is applied over a longer period of time, thus bringing light to the difficult and challenging gray areas that are not observable during a weekend course. And finally, the MDT Diploma program provides the novice MDT clinician with more confidence in determining long-term prognosis and outcomes for their patients, a skill that is often not fully developed with a credentialed MDT therapist.
Practitioners who complete the diploma program report a dramatic improvement in their clinical effectiveness and efficiency. The process of observing diploma mentors assessing and treating patients, as well as having the mentors observe and critically analyze the student assessing and treating patients, is a humbling but very beneficial learning experience.
The diploma exam is really a whole different level of clinical experience. It is by far the best clinical experience I've ever had.